So in this meeting, we present our abstract that was just published in Hematologica this month in June 2025 regarding the association between chronic lymphocytic leukemia and chronic lung disease. So what we were looking is whether patients with CLL has a higher incidence of chronic lung disease, and we looked on the prevalence of asthma, COPD, and bronchiectasis. And we look how does it affect the long course of patients with CLL. So we have our data that is based on the HMO data of more than 4,500 patients with CLL, and we looked over more than 20 years of follow-up. And what we were able to identify as patients with CLL as a high prevalence of both asthma, bronchiectasis, which account in about 5% of our patients, and COPD, which accounts in about 6.6% of our patients. And the fact that they have COPD or bronchiectasis was associated with higher risk of having pneumonia, having hospitalization. So next we looked to see whether the bronchiectasis was diagnosed before the diagnosis of CLL or after the diagnosis of CLL. And we saw that 70% of our patients had the diagnosis of bronchiectasis following the diagnosis of CLL, meaning that during the CLL, probably due to the immune compromised state, patient tends to develop lung complications and following that bronchiectasis. Then we look to see whether preventive measures that we are taking may affect the rate of hospitalization of pneumonia, and we saw that patients that were taking the vaccination of Prevnar had lower incidence of pneumonia, and also the patients who were under prophylaxis of IVIG also had a lower incidence of pneumonia. So I think the conclusion is that we, in a very large cohort of patients, we finally demonstrated that our patients tend to develop chronic lung complications, which later on is being presented as chronic infections, hospitalizations, and worse outcome, and we need to take more on consideration how to prevent it.